Hello everybody, this is Jeffrey Munson with Dr. William Clearfield of the Clearfield Medical Group. Now Dr. William Clearfield is the area's bioidentical hormone expert, correct? All right, so and the Clearfield Medical Group is becoming well known as the Northern Nevada's non-surgical anti-aging clinic. So it's really come a long way.
I hate putting words in your mouth.
I know he does, but it's really come a long way. I mean, you've been here.
Have.
How many years have you been here?
Been here 4 years.
4 years, and your clinic. It's I hear people talk about it all the time. I have people that I know what I'm talking about. Oh yeah, I know Dr. Clearfield. I go to him all the time. I'm like, really? Because he can't tell me who comes here.
That would be bad.
Yes, it would be bad. But I have so many people that I know that come to this clinic, and
but I heard you were down at one of the local department stores buying a friend of yours a piece of jewelry, and the two ladies behind the counter were speaking about me.
Yes, they were. Yes, that's kind of that was kind of scary. so
in a good way.
Yeah, in a good way. So what is the Clearfield Medical Group? What's your specialize in? It's a bit unique, I think.
Well, it's unique because we've actually stepped outside the box a little bit.
Okay.
But it should not be unique because what we do really is good, solid medicine.
Okay.
It's on cutting edge. Mm-hmm. It's always we're always looking for well grounded, well peer reviewed studies, and the latest that is grounded in science. Okay. So what I mean like that, so we talked about our Thermiva here. Mm-hmm. This is radio frequency for vaginal rejuvenation.
Okay.
We combine that with our O-shot, which is our platelet-rich plasma. We take your blood, we extract the platelets, and we can inject that in the upper vaginal walls. And between this radio frequency and our O-shot, we can tighten up your pelvic tissues. We can almost completely eliminate any type of urinary incontinence.
Oh, okay.
We can improve vaginal dryness, sexual desire, sexual fulfillment.
Okay.
And we combine that with our hormone replacement.
Okay.
So we look at the complete person.
Okay. And so you have you do non-surgical, and you specialize in non-surgical.
Yes. Well, we do. Yes. So we do about 30% of what we do is aesthetics.
Okay.
So we have a plethora of techniques for facial rejuvenation.
Okay.
We do the neuromodulation, which is the Botox. We do fillers. We do specialty filler type techniques. We have one called the Y-lift, where we go all the way down to the bone and sort of fill out the cheeks and the chin from underneath instead of just putting it on
I've
top.
heard great things about that too.
Looks fabulous.
Yeah, it does.
We can use our radio frequency also on the face for wrinkles. Yep. No injections, no
kiss
no
those
creams,
lines goodbye.
Yes, no anything. We do threads, the PDO thread lift, where we will insert. We will make a little tiny anesthetic injection. When we will insert these threads, which are surgical sutures. It's called barbs, but it kind of looks like a fishing line or something. And we can insert them under the skin, and we'll pull everything back. The barbs will catch on the skin, and we can bury them. You won't even know that it was done. It's great for the lower jaw and the neck, especially, and also in the nasolabial fold.
Okay.
We have a lot of different techniques for fillers themselves. Okay. We can do in the neck. We can do the threads. We also, if there's fat there, we have a Kybella, which is an injectable that dissolves fat. We can do with the threads. We do a breast lift. We can make them look extremely perky and even.
Okay. Yeah.
Okay, and then we can use our vampire techniques for volume and to smooth the skin out. So we have an enormous number of techniques.
And you have
not just the outside.
Right.
you need to work on the inside.
Right. And you have treatments for men too. We have the P shot.
We have the P shot, which is our platelet-rich plasma for men.
Okay.
And we'll make you a little bit bigger.
There you go. Okay. All right, guys. A little bit. I've never heard. So, and also, but all the aesthetics, facial aesthetics for men, they're used for men too, and Botox and all that. So, and you still do have a regular family practice as well.
I do, a little bit of one.
Okay.
But one of our premier lecturers, and I'm also a lecturer now, and we've been to Philadelphia to the American Osteopathic Association's scientific convention.
Okay.
We were honored to lecture for a whole day. We did 6 hours on hormone replacement.
Really, for physicians?
It was all physicians.
Oh, okay.
We had 600 physicians there. It was standing room only. They were sitting on the floors and nobody left. They were there from morning to.
Wow.
We started at 9 in the morning, and they were there. They were all there till still at 5 in the afternoon.
And you've been doing this quite a while.
About 20 years.
So where you became a hormone expert over the last 20 years.
Correct.
And that's where you kind of got your grounding and you started going into aesthetics.
I came from Northeast Pennsylvania, and as you know, the climate there is a little bit harsher than it is here.
A little bit, yeah.
And if you haven't been out of the winter there by the end of February, you get a little bit squirrely. So
Okay.
This was around 2001. It might have been 2002. I saw it was a workshop, and I said it was in Orlando. I said, okay, I'm going to Orlando. I don't care what the workshop is. Well, it turned out to be testosterone pellet insertion.
Okay.
And this new technique that had come out where we take this stuff, it's diluted botulism poisoning, and we draw it up in a needle and we put it in your face, and it got rid of the wrinkles. And it was Botox.
Botox.
Now, at that time,
yeah.
Botox had been released for use. It had only been out about 6 months.
Okay.
Okay. So I was probably, I think, the second. There was one plastic surgeon. I was the second doctor in Northeast Pennsylvania to use it.
Wow.
And it was quite a phenomenon, really.
Wow. Well, we are glad that you're in Reno.
And I'm glad to be here.
A lot of great things about this place, and you as a doctor, and you've helped me in a lot of different ways, even through medical acupuncture. So it's
that too. We do that too.
So
since 1991.
1991. So I can't.
And so before you go, so let me tell you about one other combination technique.
Okay.
So I was having a little trouble there. Sometimes you go into a little bit of a slump and whatnot. So I was having a little trouble with Botox treatments. If you're not, and so I thought about it for a while. And I said, I teach doctors. I've been doing this since 1993. Teaching doctors acupuncture needle techniques, which is you don't put the needle straight in, which is the way they.
They teach you. I saw a video. It goes straight. I'm like, no, thank you.
The acupuncturists will put the needles in at angles.
Okay.
So I said, well, why can't we do that with the Botox?
Okay.
And all of a sudden we have almost perfect placement every time.
Oh, wow.
We rarely even get a mark, let alone a bruise. We never get an eye droop anymore.
Oh, wow.
The pain factor is 95% less, and it just made a world of difference.
Oh, that's amazing. So how long have you been doing it like that?
About 10 years.
Oh, well, there you go. You're ahead of the curve.
Absolutely.
All right, everyone. So if you're looking for aesthetics, hormonal, so inside and out, you take care of the inside and the out.
We do it all.
You do it all. So give Dr. William Clearfield, or Dr. Bill as he's known, a call and set up a consultation or an appointment, and just come in for a chat, and or just come get a physical and kind of get to know Doctor and see what he can do for you. All right. Okay, Dr. Bill, thank you so much, man.
Jeffrey.
All right, everybody, have a wonderful, wonderful day, and as always, be a good human.